Hello, I am Ernesto Castañeda. I'm a professor of sociology at American University in Washington, D.C. Today, I'm going to talk to you about health disparities. So, what are health disparities? Health disparities means that a particular group of subpopulation is more likely to acquire or die from a disease than another population. In the current pandemic, we have seen that African Americans have been dying at higher numbers than other populations in the United States. So, this points to a health disparity. Another health disparity that has appeared is that Latinos have been the ones contracting the disease at higher numbers than other populations. Why is this the case? First of all, we have to keep in mind that this is not due to differences in genetics between different populations. They are too small and they don't explain the differences here. So a lot of scientific research that shows that there's no biological component to race. Therefore, there's no biological component to some groups getting sicker or dying from one disease more than others. That is not the case either for coronavirus. Pre-existing conditions are a contributing factor for the death from coronavirus, but again, the pre-existing conditions are not neutral. Malnutrition, diabetes, stress due to discrimination, and many other diseases also have been shaped and impacted by where a person lives, whether they have access to clean water, whether they have access to housing, well-paying jobs, etc. Healthcare, health coverage. Health disparities are also not due to deviant behavior in a population by unhealthy behaviors that they choose to engage in that render the population guilty for getting sicker. So it would be wrong, scientifically speaking, to blame African Americans for dying at higher numbers than whites. But why are African Americans and Latino having higher rates of infection thus far? Well, while we were under quarantine and during the stay-at-home orders that many people followed, it was the people that we correctly now call essential workers that had to keep working in person with a lot of people around them. People in hospitals, nurses, medical staff, but also people in grocery stores, people working in fields, picking up foods for us, people doing deliveries, the postal service, people working in groceries, people doing care work in the homes of the elderly, etc., etc. These jobs are not only low paid, but they are also likely to be occupied by women of color, many of them immigrants or African Americans. Therefore, these populations had economic necessity to face the risk of coronavirus at a time where other people had the luxury to be able to work from home. Now, the numbers may change as a lot of states lift the stay-home recommendations and people go out into the streets. Health disparities are the result of legacies of exclusion and discrimination. Therefore, it's not a coincidence that COVID-19 has affected African Americans at higher levels than others. And right now, there's a lot of people marching in the streets with the logo of Black Lives Matter. And this idea about life mattering for minorities is something that we see in the attention that schools give to minorities, in the attention that hospitals provide to minorities, in police brutality that results in higher deaths amongst African Americans and other minorities. Native Americans have also been suffering greatly in reservations from coronavirus. But again, this has nothing to do with the behavior or genes of this population, but rather from the exclusion from resources and power that these populations have. So as Leslie Wood, Charles Tilly, and I make the case in our book, Social Movements 1768-2018, that came out this year, 2020, Social movements throughout these 200 years of history, 250 years of history, have been about groups that have been excluded as such, demanding inclusion as equals. And today, this means that populations that live in democracies remind us that for a democracy to work, all people living in a place must have a say in what happens in that polity. So therefore, we have a chapter on Black Lives Matter, but we also have a chapter on the movements by undocumented workers and students to get full citizenship rights because they live here, they work here, and they call the United States their home. So exclusion and inequality are a problem that has been highlighted by the current pandemic. It's a problem that takes people's lives. It's also a system that makes us all more vulnerable because we have populations that are more likely to get coronavirus, be forced to continue working because of economic reasons and the low labor provisions that we have, which then in turn puts the whole population at risks. But this is not the result of individual bad actions or bad intentions, but rather from a system that produces and perpetuates these inequities, disparities, and inequalities against racial, gender, and other lines. So here at American University, we have been conducting research to address these issues, and we are also drafting and thinking about policies that can help us ameliorate inequalities in the future. Thank you very much for your attention.